Are there alternative options for dental implants? Dental implants are often thought of as to be the best option for the replacement of teeth that are missing. Implants are a permanent option that resembles natural teeth. They are, however, not the ideal choice for every person. There are some people who might not be suitable for dental implants because of numerous factors. What are alternatives to implants? In short, yes. In this short video, we'll explore alternative options to implants for teeth that might be a suitable option for patients who do not need implants. 1. Removable dentures. The removable dentures are among the oldest and most well-known options to replace dental implants. They're an affordable solution for replacing teeth that are missing. The removable dentures are either full or partial, based upon the number of teeth required to be substituted. They're constructed of metal, acrylic, or a mix of both. Although removable dentures offer good for temporary solutions, but they're not more durable than dental implants, which can lead to discomfort and irritation over the future. 2. Fixed dental bridges. An alternative for dental implants are fixed bridges for dental use. Dental bridges comprise the use of artificial teeth, which are secured with crowns that are bonded to the teeth that are adjacent. Fixed bridges for dental use are an excellent option for patients who have strong teeth on both sides of the gap caused by the tooth missing. They're a long-lasting option compared to removable dental dentures. However, they will require the adjoining teeth being shaved for the crowns to be fitted, which could weaken them as time passes. 3. Resin-bonded bridges. Resin-bonded bridges are also referred to as Maryland bridges, can be a more moderate alternative to traditional bridges for dental use. They comprise a steel or porcelain frame with artificial teeth, which are connected to the backs of adjacent teeth by using resin. They are much less intrusive than traditional bridges because they don't need the surrounding teeth be cut down. They may, however, not be as sturdy and might have to be replaced regularly. 4. Mini dental implants. Mini dental implants, a smaller form of dental implants. These implants are typically utilized to fix dentures and to replace teeth that are small where space is limited. Mini dental implants are more sensitive and require smaller bone masses than traditional implants. This makes the ideal option to those who have a lack of bone mass. They may, however, not be as sturdy or durable as conventional implants and might require frequent care. 5. Implant-supported dentures. Implant-supported dental dentures consist of dental implants as well as dentures. They comprise a pair of dentures, which are fixed into place with dental implants. Implant-supported dental dentures are more stable and comfort than removable ones and may help improve speaking and chewing. They are, however, costlier and demand a greater expenditure of time and cash as compared to traditional dental implants. There are many alternative options to dental implants which might be appropriate for patients who do not need implants. Removable dentures, fixed dental bridges and bridges made of resin, mini dental implants, as well as implant-supported dental implants are just a few of the alternatives. Every choice has pros and cons, and the ideal choice for each person is based on their particular desires and needs. It is crucial to talk with your dentist about which option is best for repairing missing teeth.